everyone, and welcome to McGill Cares, a weekly webcast series addressing a wide variety of topics to support family and informal caregivers. I'm Claire Webster, a former caregiver who became a certified Alzheimer care consultant and founder of the McGill University Dementia Education Program. I work with a dynamic team of leading healthcare professionals to oversee this program, which include Dr. José Moret from the Division of Geriatric Medicine, Dr. Serge Gauthier, McGill University Research Center for Studies in Aging, and Dr. Gerald Fried, McGill Steinberg Center for Simulation and Interactive Learning. These webcasts are made possible thanks to the generosity of donors, and I'd like to thank the Zeller Family Foundation for sponsoring today's webcast. So we have a very interesting topic. We will be discussing caregiving and the risk of older adult mistreatment. My guest is Melanie Couture. She is a researcher at the Center for Research and Expertise in Social Gerontology and scientific lead of the Health Interventions and Technology Assessment Unit of the CIUS, West Central Montreal, and affiliate professor in the Department of Psychology at the University of Sherbrooke. She co-leads 3 governmental mandates to develop training and other initiatives in Quebec on older adult mistreatment. She will provide an overview on elder abuse, how often it happens, the factors that underlie it, and the impact that COVID-19 is having on it. She will also discuss tools to identify and reduce mistreatment in caregiving situations. Welcome, Melanie.
Hello, Claire. Nice to be here.
I'm very, very happy to have you here today because, first of all, this is a topic that I am very much looking forward to becoming educated myself on. And also, I can only imagine with the current pandemic and the isolation situation, how it's having an impact on this in this area.
Oh yeah, there's a lot of things going on, but we're not here to shame people. We're here to explain what mistreatment is. You might find out that you've been mistreating somebody because sometimes it's unintentional, and to try to help people identify it, but also if you've been mistreating and you're just finding it out while we're talking, then just try to make things better at the same time. So that's what we're here for today.
So to begin, why don't you provide us with an overview of what is older adult mistreatment and how common is it?
Okay, so everybody's got in their mind the image of a person hitting an older adult. So everybody's going to say this is mistreatment. Okay, so that's for sure. So it's actually physical violence, so it's physical mistreatment. But mistreatment is way more than that. And that's why I'm saying sometimes you do it and you might not know it. Okay, so the first part is an action or lack of action, so negligence also, not just violence, that causes distress or harm to an older adult. Okay, first part. So it may be you're not doing something you're supposed to. It's not just about an action, it's also about neglect, not doing something. And it leads to harm and distress. So that's the important part, because if there's no harm or distress, then it's not mistreatment. Also, it doesn't have to be many times. You can do something once or not do something once, and it's still mistreatment. Of course, if we say I am hitting somebody once, everybody's going to say that's mistreatment. But sometimes it's little things you do every day that's actually mistreatment. But if you do it only once, it is mistreatment also. And it's always, mistreatment is about a relationship where there should be trust. So it's not about strangers. So mistreatment is really somebody you know, you love, you care about, as family members, friends, can be neighbors, can be other residents in the in your home. It can also be healthcare workers coming over also. So there is a relationship of trust that is expected. Okay, so that's also important. So it's not about strangers. And the other things is sometimes it's intentional. The person does want to cause harm or distress. Okay, so you're being mean, but often it's actually unintentional. Okay, but even if it's unintentional, you're causing harm or distress, it is still mistreatment. So that's what I was talking about earlier, is Some of you might all of a sudden realize that you've been mistreating the older adults you're taking care of. But it doesn't mean that you do want to cause harm. It just means that you are mistreating because there is harm and distress caused by your action or your lack of actions.
So could you define could you define like what is unintentional? Like, I mean, for example, like I work with a lot of family members, and they, you know, they sometimes I just can't help it. I just want to hit somebody. I'm so frustrated. I just, you know, or they burst, or they get so angry. Like, is that?
But that's unintentional? Not unintentional, because you know you're refraining yourself from doing it because you know you're going to cause harm. So if you actually do it, it's intentional. What is unintentional is more a lack of education. For example, you're saying, oh, mom, you're taking too many medication. Let's just take half of it. It's going to be better for you. Okay. So the problem is that you might cause harm by not giving her all of her medication. But the point of not giving all the medication is actually to make her feel better. But that might not be the result. Okay, so this is the types of little things that happen in a caregiving relationships where you want to do good, but you're actually causing more harm at the end. So you have to be careful about that. So usually it's more about education rather than trying to tell the person they're doing something wrong. So it's kind of different. So we're going to talk about how to deal with those later on. But like I said, it's you're trying to do good, but you're doing something wrong. Okay. And like I said, mistreatment can be it's actually really more common than people think when you're using this definition. And so, for example, there are new statistics in Quebec that actually came out that's saying that about 6% of older adults over 65 have been mistreated within the last year. So that's almost 80,000 people in Quebec. So that's a lot of people.
That's a lot of people.
Yeah. So, and the most common type is actually psychological mistreatment. So it's being yelled at, it's being insulted. So it's all these little things that sometimes we say, we know we're supposed to say it. We're just, because it's just hard. So we're saying, oh, you're mean, you're fat, you're not being nice with me. You can say some words that hurt the other person and then you feel bad about it, but still it's mistreatment. And the other type of mistreatment that's really common is financial mistreatment. So people are kind of pressuring their relative to give them more money. Oh, come on, you don't need it. I need it. You have a lot. Can you oh, come on, you have to give me some more. Oh, you know, it's your duty to buy me a car because I'm bringing you to the doctor all the time. Okay, so you see, but when people say that, they actually mean it. They don't want to hurt the other person. They're just thinking about their own needs. Okay, so, and they think that the other one really doesn't need that money because they're old and they don't do much, you know. So, or when you're gonna die, I'm gonna get all of it anyways. Why not give me some of it right now so I can buy a new house, or I can, you know. So these are kind of things that you hear a lot of people talk about, and they don't feel ashamed. They feel they are entitled to that money, but they're pressuring the older adults. So that's what I'm saying. They don't want to harm the older adults because they don't see that they're harming the older adults by doing that. So that's what I'm saying about unintentional also. And sometimes there's within the last year, about 5,000 people were actually sexually mistreated also. So this is a big taboo, that older adults are not being sexually mistreated. And you have to think about that. When there's one type of mistreatment, often there's another one also. So it might be psychological, sexual, financial, physical. So all of this comes together. So it's rarely just one type. So it's a bad situation overall. And also there is physical neglect, which is people are not giving to the older adults what they need to fulfill all their needs. So you're getting groceries every 2 weeks instead of one. So by the end of the 2 weeks, they don't have that much food or maybe no food at all in their fridge, and they can't go and get it by themselves, for example. So it's all these little things you're not doing also to make them feel better, fulfill their needs, which makes it mistreatment also. And overall, internationally, the numbers are that 10% of older adults living at home are being mistreated. And it's even worse for people who have cognitive deficits. The numbers are up to 47%, which means almost half. Okay, so if when we're talking today, you end up acknowledging that you're actually mistreating, sometime you're not the only one, but we're here today to actually explain maybe what to do to make things better for you and maybe the older adults. So we don't have a magic wand, so I'm going to give cues, and then you have to actually implement it within your own lives. But it's just to give you a few ideas on how to do things differently. And mistreatment is often done by spouses, ex-spouses, and children. Okay, so like I was saying earlier, it's not about strangers coming into your house. It's mostly your family members. Okay, and we're also going to talk about the causes, because it's important to understand why it's your family members and why it's people close to you that are actually mistreating the older adults and everyone. So I want people to understand it's not just about hitting older adults. Sometimes you don't mean to cause harm and distress, but you do, even if you've got good intentions. So it's always looking at the harm and distress. When you do something, do you see harm and distress in the older adults you're trying to help? Okay, so that's really important. And also, to be a good caregiver, you have to have two things, okay? Compassion and competency. So skills and knowledge. So one of those two things that are missing, you're in trouble, and the person you're taking care of is also in trouble. Why? Compassion is about, I want be nice to you. I want to make you well. I want good things for you. I understand that it's hard for you to be sick. So that's the compassion part. Okay. So the skill and knowledge part is, I know what I'm doing. Okay. Because, for example, if you're no good with your own finances, don't take care of your mother's money. Okay, you don't have the skills. If you're not paying your bills in time, you won't be paying her bills in time either. Okay, it's not gonna happen with magic and all of a sudden you're gonna be perfect in that area of your life. So it's about knowing what you're good at and what you're not good at. So and letting somebody else do it and saying, no, I cannot do it, I'm not good at it. And the compassion part is also about family history. Okay, so sometimes, you don't know the person, you don't care about them, so that's clear. Okay, you haven't seen your uncle in like 30 years. Why should I be taking care of him? We don't have a relationship. We're relatives, but we don't have a relationship. But the other thing is, it's about all the family history of bad relationships. If you've been yelling at each other for the last 20 years, it won't get better if you're a caregiver. Okay, with all the stress, the work, the person. Okay, so
like the pre-existing relationship, like that.
So the compassion part, what we see from studies, it's actually the fact that it's not about caregiver stress. Okay, because let's say most caregivers are stressed. Okay, but not everybody's mistreating. Okay, how come? Okay, because the stress is not the cause of the mistreatment or the bad actions or the neglect. It's actually just putting forth the difficulties that were already there. Okay, so if you're stressed out and you don't feel competent and you're unable to do it, the stress is just going to make it harder. Okay, so you won't become better at the tasks because they're stressed, or without the stress, it's going to just get worse. And about the compassion part, you know, when people get stressed, some people just, you know, go in their room and cry or just want to sleep. And
Yeah.
some people get angry and lash out at the other person. And also, you won't lash out at everybody. You just, with some people, they just kind of get you, and
Yeah.
and that person's gonna get it, but not everybody. So it's about relationships. So how the relationship was. So it's not about the stress. The stress is gonna make it worse. So usually there is family history of violence and neglect in childhood, in adulthood. It might be partner violence or neglect that was already there. It just gets amplified with the stress and the caregiving situation. Okay.
So I'd like to ask you a question here, because it brings to point where, like, I know a couple of people that I've worked with. So suppose, like, in a relationship where the husband and wife, for example, there was already a challenging relationship between the husband and wife, or the daughter and the father. Okay.
Mhm.
And then all of a, you know, and it's been very challenging. And then all of a sudden now the spouse or the father gets dementia. And so I've been in situations where I've heard the family members say, I can't believe that now, like, I have to take care of this person after the way they've treated me my whole life. Now it's
Exactly.
like they've become a burden for me, right? Like, I can't believe. And I've actually seen situations where, you know, the spouse has actually left the marriage and then
Of
left
course. Yeah.
the father's been in the hands of the kids to take care of, right? But that must be very difficult for people, right? Like that.
Well, that comes to the part of saying no. That's my main message today. If you don't have the compassion to do it, you're putting everyone at risk of harm and distress, including yourself as a caregiver. Okay. It won't work. Okay. It's you've seen there are some situations when actually the relationship goes better because the power issues have shifts, but usually if there are tensions and it won't help to become the caregiver, it might probably gonna get worse. So you're putting each other at risk of a bad relationship and mistreatment also. And mistreatment can go in both ways also. Sometimes the caregivers are being mistreated by the older adults who still
Yeah.
insults them, call them names, scream at them. So it goes both ways. So that is why, it is important to say no and make clear why you don't want to do it to a healthcare professional, because healthcare professional, if they say, oh, there's a daughter, she's going to take care, we're fine, doesn't mean that because there's somebody available that it's the right person. So that's what I want caregivers to do today, and also healthcare professionals to ask themselves, is that person going to be compassionate and competent? Okay.
Well, the lack of education is really a significant problem, because especially when caring for somebody with dementia, you know, the person with dementia could behave, you know, verbally abusive, physically abusive,
Exactly.
sexually abusive. And if the caregiver doesn't have the tools and is not educated and have the skills to be able to manage it, they are going to be in a position where they themselves are going to become mistreated. And that's the very big problem with dementia, is that most caregivers don't have the right tools to care for somebody.
Yeah, but we're also talking about distress, okay, and harm. If you've always had a bad relationship with your parents, if they're going to insult you, it's going to hurt way more than if you always had a good relationship and you're saying, oh, that's the dementia talking. It's not nice to be called names, but you won't feel, or the harm or the distress you're feeling as a caregiver won't be the same, because you don't, because of the history behind the relationship also. So you have to take that into account. And we're talking about solutions. So when it's actually intentional, okay, first thing to do as a caregiver is acknowledge, okay, I'm being mean. Okay, why am I being mean? And you what you're saying by acknowledging that is, maybe I'm not the right person to be doing this because I'm feeling like being mean, or I need more space, I need something. So it's not about ending always like no more caregiving. Sometimes it's just having less involvement in caregiving to get to a point where you're actually feeling okay and not in distress and not causing harm to the other person. So sometimes it's about, well, if it's bad for you to go every day, and it's probably bad for the other person, maybe every other day you get to breathe and you'll feel better. But also you have to work on the relationship issues. Also, you have to say, okay, what kind of relationship I've had with that person throughout my life? Why am I feeling that way? Also, do I have compassion for that person? Will I be able in the hard times to take care of that person and not want to hit them or scream at them? Or and there are family dynamics where everybody scream at each other. So, but you're not supposed to. I mean, everybody just scream at somebody else in their life, especially if you have children. And okay, so that's what I'm saying. We're not here to shame people. It's to say, okay, take a step back. If I'm screaming, I know something is wrong. It's not just about the stress. That's the thing, because not everybody reacts the same thing. Everybody's under stress when you're caregiving. Why am I at the point of screaming, and why am I screaming at that person specifically? So you also have to look at your relationship, and sometimes you can work at those relationship issues even though the person is sick, you're taking care of them, and resolve maybe some of the things also. But it's not just about the caregiving. Let's just say that.
So let's talk about some of the risk factors, okay, that can make the situation worse, especially now. Like maybe you could talk about the risk factors, and then how did COVID-19 make it so much worse, because people are so isolated, they can't go out, they're together all the time.
Yeah, exactly. So for the person who mistreats, so in that case would be the caregiver, let's say, it's about, well, if they are themselves starting to have cognitive deficits, you can see, so that can play on dealing with emotions, so the compassion part, and also the competency, because you're losing some of the skills and some of the knowledge to take care of the other person. So that's not a good thing. There's also, but during COVID, that hasn't changed. So that one is stable. So it's more about if you have mental health problems, and you consume a lot of alcohol, and we've seen that go up. Sales of marijuana and alcohol have been going up during COVID.
Right.
So we can assume that people are drinking a lot more, and mental health problems also. All that stress of being confined, of being scared of catching COVID and things like that are not helping mental health problems. So these are risk factors. And the other part is also being dependent on the person you're taking care of. So if you're staying at your mom's because you don't have enough money for your own apartment, then you're dependent on the older adults. So all these things don't help. And if we look at the relationship, so more the environment and the relationship, cohabitation, so living together, okay, makes things worse. And right now with COVID, I mean, we're living together like 24/7. We don't even go to work to kind of get a change of scenery and see other people. No. So I mean, we've seen couple, get divorced. So relationships, caregiving relationships have been problematic because of that too. So you're cohabitating way more, and cohabitation is already a risk factor at the same time. So you don't have your own space, you're stuck together. There's also the part of existing relationship problems. So on top of that, you're confined with somebody you don't necessarily get along with that well. And there's also there's that, and the social isolation. So it's not just being confined together, is that you don't have your normal social support. I know that services, home care services have been hard to get. A lot of them have stopped during COVID. So the caregivers actually had more stress. So if you already have all of these things together, and then you have more stress in the caregiving relationship because of that, and not having help, not seeing your friends, not talking to anyone else, not going to work. So really bad. So all of the risk factors actually went up and were amplified by COVID. So normally we should think that older adult mistreatment probably went up a lot during mistreatment. And I want
And
to
they
say
were
right
saying the
away,
same thing. And they
yeah,
were saying the same thing about domestic violence, right? Because
exactly, yeah,
not only older adult, but domestic violence goes up. So now, because of, I want to be, because of our time too, please tell us, what are the strategies that caregivers can put in place in terms of strategies? We're about to enter, 3 or 4 more dark months. Again,
yeah.
isolation. And then also importantly, what resources are available out there
Okay.
for caregivers?
So I would say that the first thing to do is actually self-acknowledge or identify. Don't be afraid, don't be ashamed. Just say, okay, I've been screaming at my mom. I haven't been doing everything I'm supposed to because I just don't feel like it anymore. So just acknowledge that. There is a tool that you can actually use online, which is a tool, it's called NICE, N-I-C-E.
Mhm.
So it's self-evaluation tool developed for informal caregivers. It's by Rice and Namyash, 2010. So the questionnaire is actually, it can be used by caregivers themselves or healthcare professionals. So
I will put that, I'll put that link on our website for
yeah,
those
I think it
people
would be nice.
watching. I'll make sure we'll have it on our website.
So for example, there's a question. One of them is, do you sometimes feel that you can't do what is really necessary or what should be done for your relative? Do you often feel that you have to yell at your relative? So it's all these little questions. Like I said, it's subtle. It's not about hitting people. It's all these little subtle psychological mistreatment and all these little things that sometimes when it's getting too hard, we actually do. The other thing is, if you want more information, there's a Ligne d'Abus Aîné, so the elder abuse helpline you can call. They're going to talk to you. They're going to see if it's they're actually going to help you find references for that. If you need more help, you can also go to Appui website to actually help you. And so it's all about also trying to find out, is it compassion or is it skills that you need? Okay, which one are you having problems with? Because if you're finding some of the tasks you're having to do too hard, not physically, but it's hard to do. You have to inject things, you have to fill out forms, you have to, well, maybe you don't have the skills, so you need help to do that. So it's not just about managing your emotion, it's also about doing some of the task. So it's about trying to find your own limits, what you're good at, and what you're not good at, and say no also, and make it clear. And the relationship part is super important. So never should guilt or pressure force you into being a caregiver, okay, with someone you don't feel compassionate about, or doing tasks you're not good at, okay. So make sure to know what you're able to do, not do, with whom, because you might be a good caregiver for your mom, but maybe not for your dad, okay. So it doesn't mean, and also how much caregiving is okay for you to not cause harm to the other person, but not to yourself also. So like I said, mistreatment is within a relationship where you should expect trust, okay. And the relationship part is important, because usually if you're mistreating, you are being harmed also, and you are in distress also. So it's both people are losing in this. So sometimes it's better to say no, not to be a caregiver for a person, and save yourself both distress and harm, than say yes because of pressure and everything. And like I said, it's what is shameful is knowing you're doing it and still doing it. So if you're at least trying to find help and get better and refuse things and try to make the situation better for both of you, there's no shame in that. And nobody's perfect. Like I said, everybody's yelled at their children, has yelled at somebody in their family member. The point is not doing it as much as we can. So it's not doing it. So and it's about taking care of caregivers also. And when it's intentional mistreatment, then of course the measures are going to be different, because sometimes it's going to the police will get involved if there is actually a crime, and you do have to talk to someone if there is a problem, or you think somebody else is mistreating your relative or everything. So call Ligne AWAD, the elder abuse line, to talk about it. They're going to tell you what to do. But it's also important if the person you're taking care of is actually within the healthcare system, and usually they are because they are sick, then you can actually talk to the ombudsman and make a complaint if somebody's doing mistreatment. If it's you, then talk to the social worker, say, I'm not feeling good, can I get help? Call appui, call the healthcare system saying not doing well either, and it's in respect yourself and go get help. And when it's about skills, then it's about getting education. It's about getting more information. And like I said, sometimes people want to do something with good intention, but they don't know they're actually causing harm. So that's important also. And I think a big part of what you're doing is actually giving more information in education to help people understand how to take care of someone who has dementia. Exactly.
Oh my gosh, Melanie, this was incredibly informative. And so would the role of the CLSC, because I only have a couple of minutes now, so 811, can people call 811 if they really need more help?
But I think if it's particularly about elder abuse and you want to talk about elder abuse, then the elder abuse line is specialized and it's from 8 to 8. So I think it's and like I said, they're going to help you understand what to do and where to go with that.
Do you have the phone number? What is the number?
I don't have it with me, but I think it's going to be a good thing to put it on the website.
Elder abuse. Okay, we will.
Elder abuse helpline. Super important to know about that. And you can also talk about other cases or other people you think that are mistreating your relative.
For those people watching, following today's webcast, we will put a link to all of those important resources at mcgill.ca/dementia under the resources section. Melanie, I wish I had more time with you, but thank you so much for all of this invaluable information that you shared with us today. Thank you so much.
Well, I'm glad that I've got the chance to do it because I think it's important information for caregivers to know too.
Thank you so much. So please join us on Wednesday, December 16th. As of the 16th, McGill Cares will be starting to go every second week. I will be discussing the topic of living with and supporting a loved one with ALS with Dr. Angela Genge, Director of the Clinical Research Unit at the Montreal Neuro Institute, and Ms. Lee Stevens, Psychosocial Counselor at the ALS Society of Quebec. This webcast is an initiative of the McGill Dementia Education Program, which is funded by private donations. And once again, I would really like to thank the Zeller Family Foundation for sponsoring today's webcast. If you'd like to have more information on our program or view past webcasts, please visit us at mcgill.ca/dementia. You can also email us any questions that you have at dementia@mcgill.ca. Take good care of your loved ones and yourselves, and please reach out for support if you need it. Thank you for tuning in.